Good afternoon to all. So today's remedy of discussion is Berberis vulgaris, one of the very important remedy for renal colic and even to an extent gallbladder colic. Okay, yeah. So I need to focus on the clinical part also a little bit. So this is the barberry that we know, okay, and the part used is the bark of root, okay, bark of root is used. That's why this photo is there, right side photo. Yeah, so the common name is barberry, belongs to Berberiaceae, so it's easy to remember, right? The family name is Berberiaceae. The part used is bark of root. Old method, it belongs to class 3, and new method has a drug strength of 1/10. Easy, okay. Now, Berberiaceae, family members, we need to know. It is easy. Berberis vulgaris, so equifolium will be usually there. And 2 phylums, okay, Colophylum and Podophyllum. So, that's what you need to remember. Okay, Berberis, equifolium, Colophylum and Podophyllum. Okay, pretty easy. Physical generals, you have rheumatic and gouty complaints with disease of urinary organs. That's also not much, very striking and all, but I think everybody will be knowing these things. Okay, going ahead. Pale earthy complexion with sunken cheeks and hollow blue encircled eyes. Now you have a lot of remedies with this blue, rings around the eyes or something like that. So something that you need to remember are some set of remedies. I've grouped a little bit of remedies here. These are okay. I don't think so it's there here, but yeah, what I want you to remember, all your worm remedies like Sina, Santonin. You have some shock remedies like Veratrum, Ars, okay, Camphor. Yeah, you have Bismuth. The next remedy that is coming up is Bismuth, so that also have. And you have phosphoric acid, phosphorus, natrum carb. All these remedies have this blue, encircled eyes or blue rings around the eyes, something like that. Okay. Some remedies show dark rings, some shows blue. Okay. I don't think so that's very much important here, but these are some set of remedies that you can take a note of it. Coliform gallstones. So that's what I was saying. You have some, stone forming tendency in this kind of patients. So these people have gallstones, they have renal stones also. Now, colic from gallstones, we know that bilious colic followed by jaundice, clay colored stools. So we know there is going to be kind of an obstructive jaundice or something like that. Fistula in ano with bilious symptoms, itching of parts. So yeah, again, that's your obstructive kind of jaundice again coming up here. Short cough and chest complaints, especially after operation for fistula. So this is one important symptom where you can also see in calcareous and silesia, where you can see fistula in ano alternating with chest complaints. That's an important viva question, or even your APG question. Okay, yeah. So you can see here the photo for gallstones. You can see this is yellow color, so most likely cholesterol stones. So little about cholelithiasis is you have cholesterol stones, you have mixed stones and pigmented stones. Cholesterol stones are usually solitary and they look pretty yellowish and they are hard. Okay, mixed stones is a mixture of cholesterol as well as pigments, I guess. And then you have mixed stones. One important thing to remember, throughout the world it is the most prevalent gall stone that you can see in the patient. So mixed stones are the most commonly seen. Okay, then you have pigmented stones which have pretty less composition of cholesterol. In that you have brown as well as black. Now brown stones are seen mostly in corn bile duct than in gallbladder, but black is exclusively seen in gallbladder. Brown is soft and black is hard. And brown is radiolucent, whereas black is almost always radio opaque. So one thing that I need you to remember is cholelithiasis. Your gallstones are usually radiolucent, but Cholesterol as well as black pigmented stones are radio opaque. Okay. And where do you see black stones? Mostly in children. See the conditions what is given. Hemolytic conditions. Now hemolytic conditions or Gilbert syndrome are, sorry, the spelling is wrong. It is Gilbert syndrome. Okay, not Gilbert. It is Gilbert syndrome. Now these syndromes are usually seen in children. Like the hemolytic conditions like thalassemia, it can be sickle cell anemia, hereditary spherocytosis, all the your RBC membrane defects if it comes, and it can cause your hemolysis. So these conditions can cause your jaundice, and therefore you can see black renal gallstones in these patients. And so that's why the population that you can find black stones are children usually. Okay. Yeah, so two signs, forgot to mention that. Yeah, you have Siegel sign as well as Mercedes-Benz sign in X-ray, and your investigation of choice is USG abdomen, and usually what you do is ERCP, surgical side. The modern medicine people usually what they do is ERCP. Okay. Yeah, so coming to the main thing, that is your renal calculi, because it is Berberis vulgaris. Which side is affected? It is the left side. That's why this kidney is mentioned like that. Okay, the left side. Think of an anatomical position. So if you see from your point of view, it should be left kidney that is affected. Okay. The renal or vesical symptoms predominate: burning and soreness in the region of kidney. So all the common symptoms you can see here. The renal colic, how it is described, is going to follow the course of ureter into the bladder and urethra. Okay, so that's how it is mentioned, through the ureter into bladder as well as urethra. So that's the whole excretory system is involved here. Same left side is affected in tabacum also, but lycopodium, it's the right side. Whatever I'm saying, I know you people know. So I want you to just revise with me. Left side it is Berberis vulgaris and tabacum. Right side you have lycopodium. Okay. Now next slide we have a list of remedies which the side of entities is mentioned. Renal colic, aggravation left side. Again you have tabacum there. But if it is either side with urging and stranguli, the remedy is cantharis. So something that you need to take away from this Berberis vulgaris keynotes is that there are other remedies for renal calculi, those being lycopodium right side, tabacum left side, cantharis both sides. It can be either side, can be can be left or right or whatever it is. Okay. Another important symptom is bubbling sensation in kidneys, something that you don't really see in other remedies. That is your medrenum, you given in brackets. This description I don't think so other remedies show. Bubbling sensation in kidneys, two remedies that you need to remember is medrenum as well as Berberis vulgaris. Urine is mentioned as greenish, blood red, with thick slimy mucus, transparent reddish or jelly like sediment. I don't know why it is mentioned like that, but yeah, please do remember, because it looks like a possible question, because jelly like sediment, all these catchy words are mentioned. So those things again can become a possible APGT question. So please remember, urine greenish, it can be blood red, with thick slimy mucus, transparent reddish or jelly like sediment. Okay, and movement brings on or increases urinary complaints. Now one thing I need you to remember is lycopodium has better by urination, medrenum has better by urination, the renal pains are better by urination, lycopodium and medrenum. Whereas these people, the Berberis vulgaris patient will be having an aggravation of complaint with standing. It can be slight movement, jar, all those things can aggravate their complaint. Or if they were asymptomatic and a sudden jar can cause these complaints to start. So all these things are there. Okay. Yeah, sorry, a little of clinical again. One-liners. Yeah, ureter diameter is 3 mm. Okay. The most commonest renal calculi, that is your calcium oxalate, which is a radio opaque one. But where you have a uric acid stone is usually radiolucent, and the most common radiolucent stone is uric acid. You have something called as staghorn calculi, that is known for triple phosphate calculi. Okay, I have not mentioned that. The screening method is USG. The investigation of choice for these complaints are non-contrast spiral CT, and there is a procedure that they use is extracorporeal shockwave lithotripsy. Okay, ESWL, extracorporeal shockwave lithotripsy can remove a renal calculi sized up to 2 centimeters. Okay, so that's, I think, the main things that you need to remember of renal calculi. Either side you have cantharis. Also you have something called as ferrum iodatum, but ferrum iodatum, while saying pain in both kidneys, especially left, so there is affection of bilateral region, but especially on the left side. That's why I've kept ferrum iodatum in either side as well as left side. Okay, right side you have lycopodium, you have sarsaparilla, ocimum canum. Lycopodium you have red sand in urine, sarsaparilla you have white sand in urine, ocimum canum again it's red sand in urine. Okay, hydrangea, it is left sided, and cantharis, the strangulary and burning, this constant urge to urinate, all those things will be there in cantharis. Okay, ferrum iodatum again shows a little of white sediment, just like your sarsaparilla. Okay, that being said, I think we should move ahead. Again, the renal colic, you will have this loin and groin pains. So back pain in small of back, very sensitive to touch in renal region. Aggravation when sitting and lying from jar. Aggravation when sitting as well as lying down. From jar, a sudden shake can cause problem, and from fatigue. Numbness, stiffness, lameness with painful pressure in renal and lumbar region. So all these are the common symptoms. Okay. In Bodic, you have something mentioned. There is a rapid changeability mentioned here. Second point, rapid change of symptoms, pain change in regard to place and character. Thirst alternates with thirstlessness, hunger and loss of appetite. Okay. First point, you have a little on venous system, but I have not seen exactly. This is my personal opinion. It can be there. Okay. Personally, I have not seen any prescriptions for hemorrhoids or venous congestions where Berberis is prescribed. It might be there. It might be my lack of knowledge. Okay. Berberis pain we have already discussed. It's not worse by pressure. It is not worse by pressure, but it is worse by standing and active exercise. And you have something called as diminished saliva, sticky, frothy saliva like cotton, just like your nux moschata. Okay, another cross comparison that you need to remember is nux moschata, where you have dryness of the mouth, where the saliva sticks, and it's just like your cotton. Okay. Also, you have neuralgia under fingernails, swelling of finger joints. Okay. Circumscribed pigmentation following eczematous inflammation. I think that needs to be remembered, and all this itching, burning, smarting is worse by scratching and better by cold applications. Okay. Modalities: motion, walking, carriage riding, any sudden jarring movement. Okay, that's discussed. Similar to all your renal remedies, and acts well after arnica, bri, calibi, rustox, sulfur in rheumatic affections. Okay, yeah. Which is true to Berberis vulgaris. Okay, right side renal calculi, no. Renal pain better by urination, no. That is lycopodium and medrhinum. Child screams before urination, that is again lycopodium, borax and all. But renal colic, worse standing and worse movement, it is true to Berberis vulgaris. So the answer is D. Next question, fistula in ano alternating with chest complaints is seen in all except, we already discussed that, Berberis, calcareous and silesia has the symptom. So the odd one is aeschylus. So the answer is C, and I think that's it. Okay. I think that's for it. Thank you.